Well, because we're talking fertility, and I'm going to put fertility and fasting together, okay? Our daughter, a great thing about having daughters and grandchildren is you try and pay attention to what's happening to them. And Kate had terrible morning sickness with her pregnancy, and particularly the second one. And so I started doing a bit of research into it.
Mm-hmm.
Because I thought, hang on, if you're getting morning sickness, and the more severe it is, the more likely you are to not eat, you're actually moving into a state of nutritional ketosis. So I decided to actually do the research to see what the effects of a ketogenic diet are on birth outcomes,
Mm-hmm.
which has never been done. But if you're looking for an experiment to work out if a ketogenic diet is safe or not safe, then you want to have a captive audience. You want to watch the outcomes really carefully. You want to have it reproducible. You want to be following you want clear data, and then you want follow-up data. Well, in fact, it's already been done. There are tens of thousands of results for looking at the outcomes of morning sickness and baby outcomes. And there's also multiple studies, not tens of thousands, looking at the outcome of diabetes in pregnancy. And so you can compare that data. As it turns out, the sicker you are as a baby, the mother is, so first trimester, the most critical time of growth and development, first trimester, the sicker you are, the more likely you are to not eat, the more likely you are to be in ketosis, the more likely to be the baby to be in a ketogenic environment, because they're certainly not getting high carbs in there. Then the more likely is the baby, the baby is to go through to term. The baby is to have a normal delivery. It's going to be of normal weight. It's going to have less congenital abnormalities, particularly those environmental ones, which are cardiac. And it's going to actually have normal post-development and actually be relatively smarter by the age of 2. Take the other side, gestational diabetes, which I realize is more second and third trimester. Those babies are more likely to not get through to term. There's more miscarriages. There's high and low birth weights. There's more and more delivery problems. And then those children have learning difficulties and apparently higher rates of ADHD. Again, I put that on a little YouTube thing because put it out there. And it's quite interesting. A few obstetricians got stuck into me, but then I had a few also that contact me. So I had never thought about it like that. So we've already done the world's biggest study on the safety of a ketogenic diet on the most susceptible and vulnerable population, which is a growing baby in the mother.
Mm-hmm.
We've proven it.
We've seen it, and I tell women, if you have this problem, don't eat. And if you look at nature, many other organisms and mammals don't eat once they're pregnant. Throughout their pregnancy, they hibernate. And so my sense is that the human body says, do not put that toxic food in my body. It will kill my baby. And I think that's one of the reasons we're seeing so much miscarriage and infertility today, because women are taught to eat twice as much, twice as frequently, and mostly plant-based, which I think is the biggest culprit that we have here. But I have seen your YouTube, and I think it's something that we need to talk about more in the reproductive of world. And so it's really important but women need to be hearing this for sure. So I'm really glad you put that out there, and we need to talk about it much more.
Well, again, I just come up with ideas, and then I look at them, and everything in nutrition, and I'll go back in lots of things in surgery, arthritis. I've been a big anti-smoking campaigner. When you start researching it, like the nutrition thing is just a house of cards. Whether or not you're looking at carbs or fat or protein or salt or insulin resistance. Everything you touch just collapses under one question or two questions. And so, you and I have got some inquisitive minds, and you start poking the bear and you go, whoops, that's just collapsed. And so when you find, entire careers and premises and organizations and hospitals are based on this house of cards, again, I didn't realize I'd not only opened up Pandora's box, I kicked it open.
And it's trying to sting you a little bit. And yet you're not being taken down by it. So that's really honorable, and you care about the patients and the science and sharing something that I think so many people are just ignoring and walking away.